Good afternoon and welcome to the return of our weekly update. Dewan Utek, Director of the Department of Behavioral Health. All right, what a difference a couple of weeks make. I did get some much needed rest. If you'll recall at our last update, we talked about self-care and my need for self-care, and I did get to celebrate my anniversary, 13 years. It's a lucky 13 for us. With my husband. So got to have some relaxing time, and in the meantime, chaos broke through. This is what happens when you leave. All right, so across the world, we continue to see COVID grow. 205 million cases of COVID with over 4.3 million deaths now in the United States. We have over 36 million cases and over 618,000 deaths, almost 619,000. In California, we now have a 6.9% positivity rate. It is declining a little bit, tiny bit, but our cases and deaths are rising, so we're not really sure what that means. It could be fewer tests or it could be a slight decline. In Fresno County, we now have 107,733 cases and 1,751 deaths. Over 4,000 cases in that 2 weeks. And if you'll recall, from week to week, we were just seeing a few hundred cases. Now we're seeing thousands of cases again. In terms of hospitalization, holy Toledo. If you look on the right-hand side of this slide, you'll see that we were hovering in the 40s and the 50s, up and down. We're now at 260 people hospitalized. We've had a quadrupling of our hospitalizations in Fresno County. We now have 46 in the ICU. We had 8, 10, 14. We've quadrupled, the number of people in the ICU as well. And we have 17 ICU beds available. In terms of our testing, we're now at a whopping 9.1% positivity rate. 2 weeks ago when I reported we had doubled in 2 weeks, we've doubled again in 2 weeks. We went from 4.0 to 9.1, more than doubled. Definitely not on the right trend. You can see that positivity going up again, as if we're right back into our last surge. In terms of vaccinations, we are seeing an uptick in vaccinations. It seems that some people who were not yet vaccinated have seen this rise in hospitalization and case rate and are choosing to get vaccinated. So we do have 970,677 doses given of vaccine in Fresno County. This represents 48.4% of our entire population has had one dose, and 58.8% of those over 12 years have had one dose. I think last time when I reported, we were around 10,000 doses in a 7-day period. We're now over 14,000 doses in a 7-day period. So definitely an increase, which is good. Of individuals over 12, we have seen an increase in that, as well as individuals over 65. So still continuing to chip away at that population. So overall, in terms of what's happening in Fresno County, clearly cases, hospitalizations are on an upward trend, with deaths increasing again, and all counties are now in the purple tier again, for the most part, in Fresno County. And we also have some of the lowest vaccination rates. Even though we're not in the purple tier, we're still kind of tracking it that way, and so most counties are in the purple tier. And you can see here our case rates. The top line is California, the bottom line is Fresno County, so we're tracking right along with the state in terms of the case rate per 100,000 going up. In California, same thing, new cases, hospitalizations, and deaths are on the rise. But what we are finding, and I'll share some information with you, is that the majority of the people who are getting COVID, getting hospitalized with COVID, and dying of COVID are unvaccinated. We are now seeing new vaccine mandates and some mask mandates in the last few weeks. The state of California has mandated healthcare workers, teachers, and school employees. We're also seeing different federal work groups being mandated to wear masks. And this is really happening across the United States. I have a bunch of papers in front of me, and I'm going to share some very specific information because it's very, in our incredibly politicized and polarized society, everyone's fighting about everything right now, whether that's wearing masks if you're unvaccinated or being required to be vaccinated. And I've left a lot of time at the end for questions because I know we'll have questions from our group as well. But that's pretty much what's going on right now. Cases remain up across the nation. Delta is still the dominant strain in the U.S. I did want to talk about some other variants that are happening. We heard about Lambda previously. Remember, this is a vaccine of interest through the World Health Organization. But the one that's been identified, which started in Peru in December, might be receding. We're not really seeing it being spread as much as we saw the Delta variant, but they are definitely watching it closely. There's another one, doesn't have a Greek name yet, B.1.621. This is another one that they're really watching. It first arose in the country of Colombia in January, and so that's another variant of interest. England is looking at that as a variant of investigation. It has some mutations that have been linked with increased transmissibility and reduced immune protection. So those are the ones they really pay attention to, the ones that are easier to transmit and that the vaccines may not be as potent against. But remember, as long as we have these types of wide outbreaks, not just in the United States, but across the world, we will continue to see mutations occur. And this is why it's very challenging to get a pandemic under control. A year ago when we had these conversations and we talked about, were we doing enough, were we doing too much, were we taking away too many people's rights, were we really seeing the number of cases and hospitalizations and deaths to warrant the measures being taken? What public health experts were really trying to do is prevent what's happening now, which is these vast outbreaks in large parts of our society where there are many, many people living closely together, like what we saw in India and now we're seeing in other parts of the world, where the outbreak is spreading so quickly with a variant, the Delta variant, that it's producing new variants. So that's where we're at. The CDC is expected to endorse a booster shot for high-risk populations. I've already been getting questions from staff about this. Would they be eligible? Will we offer it? What I anticipate is that if and when that booster shot gets approved, there'll be a couple of variables. One, will it simply be a third shot, very much the same as the shot you already received, or a second shot if it's Johnson & Johnson? Or will it be a new formulation of a shot that we have yet to produce or receive? So the timing could depend on the answer to that question. Once we know that, then we're just going to be waiting for guidance from CDC as well as state and local public health officials on how that booster shot could be administered and who would be eligible for it. Again, likely high-risk population, so certainly people over the age of 65, and then next, people under the age of 65 with underlying health conditions. CDC is expected to take Pfizer out of the emergency use authorization category and into full vaccine approval. I would anticipate that Moderna and Johnson & Johnson would follow. Again, we are in a situation now where we have vast amounts of data telling us about the effectiveness as well as the safety of these vaccines. And so we have identified some side effects that are very, very rare, and those are known, and then we also know that it's effective, and I'll show you some slides in a minute to help endorse that. The CDC has also this last week endorsed vaccinations during pregnancy. I get lots of questions about this and concerns about fertility as well as the safety during pregnancy. There is no evidence of miscarriage or infertility. I don't know about any of you. I just filled one out today. I get the V-Safe text. And the VSafe text is the federal database for those of us who've been vaccinated, where early on after vaccination, you fill it out daily, and then eventually, periodically. I'm now like 6 months from my second dose, and they're asking me the same questions they asked. Have I gotten pregnant? Have I gotten COVID? All these different questions. And that's some of the information that's utilized to inform us about things. So when people get COVID and they report that through VSafe, we know they were vaccinated and they had COVID. If someone said I had a miscarriage or I have not been able to get pregnant, then that's recorded in there. And none of those are showing that there's a higher incidence of anything like that in vaccinated versus unvaccinated people. So we have really good records about what the usual incidence of miscarriages, and miscarriages defined as a pregnancy loss that occurs between 6 weeks and I think like 22 weeks or something like that. And so miscarriages that occur before 6 weeks are very, very common. Oftentimes people don't even know they're pregnant, and so they don't count that as a miscarriage. I personally have had miscarriages at 9 weeks, and I also lost a baby at 20 weeks. And so those things do occur naturally. This was well before the COVID vaccine. And so we have data about that, how often that occurs, age ranges, things like that. They're not seeing any increase in that with the vaccine. And so they now are endorsing it. What they are seeing is some pregnant women getting very, very ill when they're pregnant. There have been deaths of women who were pregnant before and after delivery with COVID. And so the CDC feels that they have enough information to endorse that now. In terms of breakthrough infections, I get asked this question a lot too. Why get the vaccine? You get sick anyways. Vaccines are designed to prevent severe illness, not prevent infection. And some vaccinated persons will become ill, hospitalized, and die. However, and I'm going to give you the next slide, here's some information about breakthrough cases and the current surge. So this is a little hard to read, and I'll be happy to send it out. I'll have Tina, when she sends out the recording of this, send you this graphic. But basically it lists quite a few states and information about cases of COVID amongst vaccinated and unvaccinated persons. So I'm just going to read this. In Alaska, 96% of the cases are not fully vaccinated. Arizona, 94.1, Arkansas, 96.4, California, 98.6, Connecticut, 99.9, and on. There is not a single state listed here that is below 94%, and most of them are above 98 or 99. And so what that means is 94 to 99% of the cases of COVID are among people who are not fully vaccinated. They have not received full doses and are 2 weeks out. And so it's pretty clear at this point that the vaccine does work to possibly both prevent cases as well as reduce hospitalizations and death. I did just want to briefly talk about, there's all kinds of defiance of mask orders on both sides. Texas governor has said you cannot mandate masks for schools, but quite a few school districts in quite a few cities in Texas have decided to defy that mask mandate, including in Florida, similar type of situation. The U.S. military is going to mandate vaccines for troops, and Washington State is going to mandate vaccines for government and health workers. Cases in the United States are at their highest level since February, and that basically we are averaging more than 100,000 new coronavirus cases a day. This is hitting particularly hard, as I've mentioned, in areas where people remain unvaccinated. We also have had deaths nearly double. We're now at about 516 a day. And so basically, in some areas of the country, Arkansas and Missouri are really, really hard hit right now. And so lots and lots of focus on do we vaccinate or not? Do we mandate vaccines or masks or not? Texas is reporting that their system is essentially overloaded. They have something like 51 ICUs that are completely full and unable to take anyone else. And so more than 10,000 Texans have been hospitalized just this last week. At least 53 hospitals were at maximum capacity in their ICU units. And so here we are again, and now we have our own mandates. So I thought I would take questions, and I think Tina's listening. Tina, I forgot to bring the question that you sent me via email. If you can text it, and I don't have my phone, but Brian will share it with me. So let me look over here. I had a couple of messages that were retracted. Not sure about that. Maybe you all weren't, maybe the question was already answered, not sure. I have sent out a few different emails. I apologize. I had some confusion about what has to be done by September 30th, so let me describe to you. We had 2 health orders issued pretty close together. The first one, right before I was going on vacation, mandated that healthcare workers had to show us proof of their vaccination status, and if they were not fully vaccinated, which meant 2 weeks after the final dose of a single or double dose vaccine, then they had to be tested weekly. And they had to wear masks. So we were in the process of getting that up and running. August 9th was the day it had to start, which was this last Monday. So we got testing in place with Pinnacle, and I think you guys have seen that. And then shortly, right when I was returning from vacation, the state issued a mandate that you had to be vaccinated if you work in a healthcare environment, with 2 exceptions. One exception being you have a qualified medical condition that is supported by a note from a physician saying you have a medical condition where you are advised not to have the vaccine. So an example of that would be, if you were pregnant and your OBGYN agreed with you that you did not want to get the vaccine, then at least while you were pregnant, you wouldn't have to get the vaccine. Or you might have some other underlying health condition that for some reason your doctor feels that you shouldn't have the vaccine. And then the other is religious beliefs. We don't have the declination form yet, which is what we'll be utilizing for staff who want to decline the vaccine and feel that they're qualified to do so. But I do believe that you simply have to state for your religious beliefs that you have religious beliefs that prevent you from taking the vaccine. And then for those individuals, you'll have to be tested weekly, and you'll have to wear either a surgical or an N95 mask. Now, the confusion for me came from the first order said you had to be fully vaccinated in order to qualify for not needing to be tested. The second order says you have until September 30th to get your final dose, but it doesn't require you to be fully vaccinated, meaning 2 weeks past that. And so in working with County Council and Maine Human Resources, I got confused, and we kind of went back and forth. And so the latest is the greatest. So basically what it is by September 30th, you either have to have the second dose of a 2-dose vaccine, the first dose of a 1-dose vaccine. You do not have to be 2 weeks past that period of time. You could get your last dose on the 30th. And then if that's the case, then you get out of that weekly testing, and you don't have to wear an N95 or surgical. Remember, in our department, we're just going to mask. But if you're unvaccinated, you'll have to have that surgical mask or that N95 mask. And you'll have to have that declination form by September 30th, which is over a month away. Don't worry, we'll get those forms and be able to share with you how to complete them. And so hopefully that answers some of your questions. We do have 3 test dates every single week. We have them at Heritage, we have them here at the Hawk, the Health and Wellness Center, and we have them on the Kings Canyon campus every single week. So we're making available to you places where you can go and test if you're unvaccinated. And you also can test on your own. You just have to provide us with the results. But what you also have to do, and not everyone has done yet, is you have to fill out the Relias module saying, I am or I am not vaccinated, or I decline to state. You can say that. But if you decline to state or you're not vaccinated, then you have to do the testing. If you are vaccinated, you have to upload proof of vaccination. So I know we've had some staff who've struggled to figure out how to prove they're vaccinated, and we'll work with you on that. And then other staff who simply haven't even filled out the form. They haven't responded to it at all. And it's very uncomfortable for me to have to say this, but you're subject to disciplinary action if you don't comply with this. This is a state order and we're following through on it, and so we need you to work with Human Resources, get that form filled out, and help us comply with this mandate. Okay, has the Fresno County emergency order allowing telework been extended? Yes, it has been extended until October. And all that does is allow us to offer telework through the emergency telework order. It doesn't really impact what we do in terms of who we have in the office or not. It just allows us to do that. So our expectation is that, you know, when I was gone, I know Susan and Marianne went over that return to on-site work. And so effectively, you know, by Monday or so, we can implement it. Of course, we're going to pay attention, and it depends on your work location, what the layout is, what's happening. And so the return to on-site work guide is our guide. It tells us what we need to do, but we'll be making decisions on a day-to-day basis based on what we're experiencing, what the business needs are, and what the environment is where the business needs have to be met. To determine what the work schedules will be. So some areas might have different work schedules than others. That's just the way it's going to be. Okay. When will unvaccinated employees be required to wear an N95 mask, and who will make sure that unvaccinated employees comply? I believe, if I'm not mistaken, and I've sent out so many emails, so I apologize, and Helen, feel free to weigh in. I believe that we've stated that by next Monday, we'd like unvaccinated staff to wear either an N95 or a surgical mask, and you can get those from HR. They have both available, our DBH HR. If you can bring your own, that's fine too. And we'll be working with supervisors to make sure that we have compliance with that. Okay, and then there was a question about unvaccinated individuals must wear a surgical mask or higher level respirator at all times while in the facility. Does this mean in private offices? And will all employees be required to have their doors closed in their offices if they're unmasked? Yes, if you're unmasked, I'm going to answer this in two parts. Regardless of vaccination status, if you're in a private office, you do not have to be masked, and your door needs to be closed. Okay, so if you're unvaccinated and you have a private office, you don't have to wear that N95 or surgical mask unless the door's open or you're sitting with someone in your office or you're anywhere outside your office. And if you have any questions about that, feel free to ask. We have had people that we've had to remind multiple times to mask up. That can and will result in disciplinary action. So please, I know it's easy to forget. Every once in a while I'll start to leave my office and I'll think, oh my gosh, I gotta put my mask on. And that happens. And so the occasional forgetting to wear your mask will get a gentle reminder for us, but if you consistently do not wear your mask, you will be subject to disciplinary action. Will booster shots be required to maintain employment? I don't anticipate at this point, it's not right now, that is not part of the order. And we are following the state's order. Booster shots, it's my understanding, will be offered to people who are at high risk. I do not believe they will be mandated, at least not now, and I haven't heard any time in the near future. But we'll keep you informed if a new order does come down about that. How soon will the declination forms be available and an answer given as to approval or denial? That's a great question I don't know the answer to. We're working on getting those. Obviously, this is the type of thing, because it's a state order, that we are expecting and hoping that the state will provide us with a template for that. There is a call next Wednesday. I thought it was this Wednesday. It turns out to be next Wednesday. That is a statewide all behavioral health provider call, and that will be one of the questions we ask on that call is when will we get either the form itself or some sort of template of questions that we could create a form for. Obviously, when it's this type of order that has some sensitivity to it, we want to make sure that the form is exactly the way it's supposed to be. So we don't want to create our own form only to find out that it didn't meet the state order requirements. And so I'll ask you for some grace and patience because I don't have control over this. But right now, today is August 12th, and this mandate begins September 30th. That's a deadline. So I think we have enough time to both get that form. I think it'll be pretty straightforward though. Filling out the form, you'll have to have a doctor's note or you'll have to declare that you have religious beliefs that do not allow you to be vaccinated. I don't know that there will be a significant approval process other than validating that those things were provided. Regarding, we had a question previously about SurveyMonkey and the confidential nature of the platform and whether or not it would protect our information. And this is from one of our IT folks, that it has been verified that it is a secure platform. And so when you submit data through SurveyMonkey, that is secure and will protect the confidentiality of your information that you're providing. And yes, Helen reminded me that correct Monday, August 16th for surgical or N95 masks for unvaccinated folks. Anything via text, Brian?
That question was answered.
Okay. The previous question that I thought that I had not brought with me, in fact, I know that I had not brought with me, apparently was answered in the update. So I'm confident that additional questions will emerge. And as we get more information, I will provide it to you. Hopefully I won't make mistakes all the time, but I can't promise. It's all coming fast and furious. And I do really try my best to get information out to you as quickly as possible. Obviously this time, that speed was at the expense of accuracy. So I'll try and be a little more methodical in my communication and make sure that the information is accurate. We are running things past County Council and Maine HR because we want to make sure that we comply with the mandate, but we do so appropriately. And so I do want to reassure you that we are getting their input on how this gets implemented. And if you have any questions, feel free to ask them. Doesn't look like we have any more questions on chat, and we don't have any via text. We will be sending out this as a recording, and if those questions arise afterwards, as usual, please feel free to email myself or Tina Young, and we will be happy to get you an answer either via email or at our next update. And so stay tuned, stay safe, and we'll see you next week.